Alrighty, so we're going to talk about cupping and scraping along the inner shoulder blade musculature as well as the rotator cuff. We would like to give a little shout out to Rhea Rabbit at Oxblood Ink for this beautiful little ink job here. We'll get a nice close-up of that. And we're also going to talk about the fact that I can cup over this without fear of damaging it. If this was really fresh, I would not. That much is obvious. It's still healing. But this is now a year old and looking gorgeous. So, as we had talked about in our previous videos, that I would start with static cupping. So let's say that she has a restriction here along her rhomboids or her mid-trap. I can work in a circle, counterclockwise or clockwise, north-south, east-west, and depending upon the area of restriction, we move the cup. Again, circles, north-south, east-west. Why I decide on one over the other is more so about where do I feel that restriction. So let's say for Kelly, she has a little issue with external rotation. What I'm going to find is maybe the area that's troublesome for her, and now that it's pinned there, she's going to practice a little external rotation with that left arm. And I can continue moving it, or I can just let it be, so that I can observe what the shoulder blade musculature is doing. If she finds that it's more comfortable with each repetition, or that overall the discomfort underneath the cup is improving, we move it to the next spot. Again, maybe this is more on the supraspinatus, the top one of, again, one of your rotator cuff muscles, kind of the top one along the shoulder blade. But if she finds that this was difficult initially, but it's improving slowly, we keep it on for a few repetitions until that motion improves. We move on. We add a little gel to the skin to help it move. And you can see that she has gotten a little red, but we're not leaving any extensive bruising for any length of time. From here, I can follow the rhomboids, either against the grain or with the grain. Part of our schooling as therapists is having an extensive knowledge of which muscles go where and in which way they run. This helps us to identify the specific issues that you may be dealing with. We move out into this rotator cuff. Right, little tender there. And again, we can see that she's getting a little bit red, so I move on to the next spot. She's getting a little too red for my liking. We can see a little bit of increased discoloration just below these final branches. So I'm going to give her a little break prior to beginning the next step. That next step would be the use of movement with cupping. So now that her skin has calmed down a little bit, especially on these further areas, I'm going to apply the cup, and she's going to perform that external rotation, like that pitching motion. And I'm going to follow this muscle along the grain first, and if I feel like there's a restriction against the grain, I'll work with that. She's practicing good breathing. Breathing's important. Again, nice and red. We give her a little break, and we go from there. If I feel like I need to do more specific work, I can work with any of the edges of my tool here to work the specific, more specifically. So the supraspinatus is a small muscle. It's only about the size of the my pointer finger there. So I wouldn't need this big edge. So maybe I just work with the second largest edge. And if things are improving through there, maybe I switch to the finest edge, the smallest edge. The same is true for these bigger muscles down here. Ooh, she's got a good crunchy right there. And just like that, it's gone. And I can follow up with my hand as well to feel the texture of the muscle as I come through. And again, what I like to finish out with is just general scraping, kind of to calm the whole area down. Move away from those focal spots, even though we know that we've worked the entire shoulder blade.